This is Hard Written TV, and I'm Eliany Mejia. And today I have the pleasure to have a friend and a mentor, Dr. Luigi Di Biase. He's the section head at the electrophysiology and director of the arrhythmia services at Montefiore Medical Center. Following our theme today, that is about teen matters, I just had to have Dr. Di Biase with us today because I have experienced how he has built the EP lab at Montefiore. And for me, being a trainee there, I saw the exponential growth in the services and how you have done an excellent job with your team. So I want to ask you, tell me about the story from the very beginning, how you did it. Tell me the key ingredients to that.
Well, thank you very much to FHRS TV and to you for the invitation. Yes, I mean, in my career, I had the privilege of, experiencing the work of different EP labs of different countries. I was in Italy and I did my cardiology and EPs in different cities. Then I went to US, I experienced Cleveland Clinic, Texas Cardiac, a little bit of California, and I've been in different EP labs. And everybody does something a little different, but you can pick something good from many things. And I think if you are stuck in the same place all the time, you think that that's the only way to do things. If you go to different places, you know, these people are doing things in a different way, and you pick the best of everything. So when I joined Montefiore, I was asked to, grow the program. Yeah. And that's a difficult thing to do. And it's something that you cannot do by yourself. You have to have a team or to build a team and to, award the team for their work. So I arrived there, I had the support of the people, above me, the chief of cardiology, the administrator,
Dr. Garcia.
Dr. Garcia, and you need the support, okay? Once you have the support, I think my attitude was not to destroy what is there. I mean, Montefiore has a, reputation in the EP field, and the first pacemaker with the cephalic implant was done by Seyfer Furman and Montefiore, the first pacemaker in the world with cephalic approach. So you have a reputation
that you have to maintain.
Yeah, so we have a reputation to maintain and a program to grow. So first of all is respect the people that are there. And instead of telling, oh, I'm coming, I know how to do things, and you do my way, my approach has been observe the program, try to address what's going on, try to figure out the best of each person there, and then start building by making step-by-step changes, because every change usually can be seen as an abrupt change and can be an obstacle, right? Differently, you go with the respect and you start making small changes on a daily basis that are not perceived as a problem, but they can become successful in the long term. So I had to work at different level, and again, I'm a team player. I can't do everything by myself. So you start with the doctor, then you move to the techs, then you move to the PA, then you move to the nurse. Everybody needs to work together. The example I like to play is when you don't have a team, you have to think about an orchestra. In an orchestra, the music plays and people don't talk to each other. Everybody has to play a certain time with a certain rhythm without talking to each other, by following just the instruction of the...
And they know what to do.
And they know what to do. So the ideal team is built when everybody know what they're doing and they have to do it at the right time. So it takes a lot of work to achieve that level. So I can tell you that I start by noticing that we didn't have scrub techs, and that was increasing the procedure time and the turnaround. So I implemented the presence of scrub tech in the hospital. Then I worked on improving the time between procedures that was extremely long by pushing the lab, and sometimes also by letting them understand the relevance of treating more patients and making everybody aware of the importance of doing more. more cases, grow the program.
Less time, more satisfaction.
More satisfaction. So little by little. So we start with the scrap tech, then motivation of the team and recognition of the team role in each aspect.
Yeah.
Then, so we reduce the the time in between procedure. We motivated the staff
and increase the numbers.
So this already is allow you to do more cases in one day. Then start looking into the referring and when to put patient on the table, and also expertise. When you have a higher volume, every nurse gets familiar, every tech gets familiar, every fellow gets familiar to complex procedure, because they don't do one every week, they do 4 every day. So you repeat this all the time, everybody gets familiar, and instead of perceiving complex things as extremely complex, they become routine. So my advice is step by step, appreciate whatever you have and try to motivate people, and little by little make changes that are something that you need to have in your mind. Then you have the more difficult task with this, create and motivate all your colleagues. Everybody needs to be on the same,
So what
speed.
what Luigi just mentioned is really important. It's the key of observation, looking at your team members, looking at your staff, and looking at their potential, and to try to help them to develop to achieve their full potential for the whole team as a group. So that's amazing. I really love what you have done. I have experienced myself how you have grown that program, and I just want to share with the rest of the team and with the rest of Heart Rhythm TV how you have done it. So I congratulate you for that.
Thank you so much. I make an analogy with the orchestra, but I also believe like you can make an analogy with a team. I'm European, I like soccer. So you also need to assign to member of your team a role. And you need one goalkeeper, one forward. The forward guy will score the goal, but he cannot do it without the goalkeeper, without the middle field.
It takes a village, right?
So you need to create a team where each one has a role and respect each other. There are some people that will score more goals than others. It doesn't mean that the others are not relevant to the team. So I think this is the message for everybody that want to build a team and respect everybody.
Good team dynamics and a good team workflow, right? So thank you so much, Luigi, for being with us. This is Heart Rhythm TV. Thank you so much.